How have optometrists working in independent and multiple practice been working over the last 16 months? And crucially, what role has virtual consultations played? Optometry Today partnered with Spa Medica to run a roundtable discussion to find out. In a wide-ranging conversation, we talked about the response of patients to remote care, discussed clinical case studies, and considered the growing impact of artificial intelligence. We must caveat that our contributors' connections was a little patchier than we would have liked, but what they had to say was enlightening. Let's meet our practitioners.
I'm a senior optometrist and clinical lead for a small independent group of optometrists in and around Birmingham. I work one session a week at Walsall Manor Hospital.
I have a Specsavers franchise, so I'm a contract of a Specsavers franchise. But more relevant to this is that I chair a primary eye care company, and we also have a separate company that provides triaging for CCGs. Through those, we triage probably about 1,000 people a week.
Both Joanne and David have been performing a lot of remote consultations over the last year. Joanne identified issues early on, with a segment of her patient base proving to be less technologically literate.
I found it a bit easier if patients sent me photographs rather than doing a Zoom call or a WhatsApp call, because they tended to get a bit distracted by the phone. So I tended to find that I kind of did a telephone consultation, then asked the patient if they said, I've got a red eye or something, got them to send me a photograph. And then I called them back once I'd put all the data on, because I was seeing a lot of patients that were not our existing patients. So there was no information from that. So you're kind of doing a history and symptoms as well. And it really works quite well.
I agree with Joanne. Photos, far higher resolution, far more diagnostically significant than using videos. The other thing was what we set up a really consistent triaging platform with the software, and as we, as we found hiccups, in what we're doing and little gaps and things that we missed, we're having to make hand notes for. So we tend to do a lot of things with drop-down boxes, which prompt, so it makes it much easier to complete accurate record keeping.
They both view the clinical work that optometry has taken on over the pandemic positively. They feel it has changed the shape of the profession in the eyes of the wider medical community.
COVID's definitely pushed us out of our comfort zone as clinicians and made us step up and do what we've always known we can do.
As a profession, I feel we progressed a lot through these difficult times. We've helped NHS immensely, and I think we maybe don't realize how significant the role optometrists have played over the last 12 months. I don't think our role would ever be just, is it better with one or two in the future? I always wanted to have a greater role than as a refractionist. I'm really excited by it. I hope, we take this and move forward with it. And I think it'd be sort of, travesty if we, went backwards with it.
It was quite the unknown to begin with, wasn't it? And now it seems very more the normal. And you think back to a year ago and it feels like that we've been doing these things much longer than a year.
I think COVID will be with us to stay. That's also, though, impetus for the CCGs and the national bodies to commission other services with us.
I think it's about looking for the opportunities that are there and how we can adapt ourselves, and not, as David said, not stay in our little bubbles, but look at where those opportunities might appear and preempt them.
One of our goals was always to try to reduce the burden on the NHS. And so we wanted less people to go into secondary care. If we stopped, sort of 20 people going to A&E or sort of making an appointment with the GP, it let then the 20 people who maybe really needed to be seen.
The practitioners shared case studies of the patients that they've helped with optometric emergencies, noting that it's work that they would have been unlikely to have had the opportunity to manage pre-2020.
I remember this one because it was summertime last year. We had somebody phone in, he'd been doing a bonfire and he had a cinder enter his eye. go into his eye, and they discharged him. So I got the triage through at 7:30 in the evening. We did FaceTime. So I FaceTimed with him. I'm in the parking lot. I've instructed him to go buy contact lens solution, and I teach his girlfriend, who's a solicitor, how to, buying FaceTime, evert his eyelid and irrigate his eye, and she removes the cinder. And so he's fine. I remember that one quite vividly, that this was the stuff that you just did because patients, are in difficulty. And so that was probably one of the odder triages that I've had. And I would say it worked. He was fine.
I saw a patient last week who had done a remote triage. It was right at the beginning, as you say, in the really bleak times. She was very anxious, and the history and the symptoms and kind of what she was telling me was really conflicted and this kind of thing. And it turned out that there's a possibility that she'd got some sort of optic neuritis going on. And I did speak to her probably on a monthly basis over 7 or 8 months. She saw me last week, and she said, she realizes that a lot of the issues that she was having at the time was down to anxiety. We timetabled, a little reminder in the diary to just give her a call and check that everything was okay. And she said how much she appreciated that, because she knew that we were there, and it helped manage those anxieties that she had.
To be blunt, how do you find the time, and how do the practice team find the time to be able to support patients at that level, which is clearly not how life used to be pre-COVID? How does the profession adapt in a way which is sustainable?
As an independent group, we've always worked on patient satisfaction rather than volume. I suppose by doing remote consultations, it does save time, and you can use that time for more value.
I remember that we had an A&E nurse give us a call, an older gentleman. He'd suffered with shingles and had affected his eye. And he'd been listed. It was probably one of the worst cases I've seen. Just looking at the pictures, I was in pain. And he was actually quite happy. I spoke to the A&E nurse, and I said, okay, he needs a cyclovir. We need to go with tablets and drops. And she just went, okay. And then I realized that as optometrists, we were now, our advice was sought after. They got it all sorted, and patient had a full recovery without any significant corneal scarring, which was just, for me, it's one of those moments that I'll probably remember for the rest of my career.
We then spoke about the future and what it might mean for optometry. We wanted to know what kind of technology our practitioners would want to see to make their time in practice better.
In my wish list of AI, I would want something that would enable me as a clinician to make clinical decisions more confidently. And in doing that, the add-on is that then we can manage those patients ourselves before we refer on for more specialist treatment, because we know we're on the right track, and we've got that interaction where we can then say, okay, this risk profile's increased, so we now need to send that patient off to see that consultant. And that patient then feels more confident in our ability as clinicians, and is perhaps not as daunted when they get to the hospital, because they're already on that path of knowing what the problem is.
My dream AI innovation would be some way of analyzing the data we have, because we've got so much data about these patients that which we analyze them with as an individual. But if there's some way I could take all that information, the results of all these, say 10, 20 years of eye tests of patients, the fundus photography, and this software platform, this AI would then analyze that and then give me a risk profile for this patient for the future. Give me prompts. So when I'm in a test room, it's prompting me, for that, look at this, examine that. That would be absolutely wonderful.